Graying of hair is a very common phenomenon as we age, but the problem these days is very young individuals who are school going are also graying. Hi, this is Dr. Ravali Yalamanchili, Chief Dermatologist, Neha Dermatology and Aesthetics. Today, let us understand the causes for premature graying and how do we prevent it. Graying happens when your cells called as melanocytes, which are pigment-producing cells in your hair follicles, stop producing the pigment or the color to your hair. This is a very common phenomenon as we age, and we tend to get gray hair after 35 years of age. But if this graying starts quite early, less than 20 years of age, we call it as premature graying or cavities. What are the causes for early graying? Number 1, genetic factors. Family history is the strongest reason why we develop early graying. If your grandparents or parents have it, there's a high chance of your melanocytes or pigment producing cells aging faster, thereby leading to graying. Number 2, oxidative stress. Free radical damage to your melanocytes, be it because of your pollution, stress, smoking or other factors, it can lead to damage of your melanocytes, leading to graying of your hair. Number 3, vitamin deficiencies. Most of the nutritional deficiencies like deficiencies in iron, copper, vitamin D, vitamin B12 can lead to premature graying of your hair. Number 4, thyroid and autoimmune conditions. Most of the autoimmune conditions like vitiligo, alopecias, all these conditions tend to affect the pigment production in your melanocytes, this eventually leading to early graying of your hair. The last and most important factor being your lifestyle factors. Stress can lead to premature graying of your hair. All other factors include improper sleep, not having a proper diet, and also exposure to a lot of pollution. How do we diagnose this condition? It is very simple. If we see people having graying of their hair quite early in their age, that is premature graying. But we dermatologists would like to look into other factors like your nutritional deficiencies if you have any underlying autoimmune conditions triggering this process. We then correct these nutritional deficiencies so that we can slow down the process of early graying. What are the treatment options for early graying of your hair? Number 1, if you have a family history of early graying, please understand that none of the treatment options would actually help. Number 2, if your early graying of your hair is triggered or aggravated by external factors, correcting these factors will help in slowing down the process. Number 2, if you have any underlying nutritional deficiency, we would like to treat them based on how low the values are. And number 3, some of peptide-based serums, pseudocatalase-based creams help in slowing down the graying process in your hair. Some of the hair supplements like biotin, folic acid, and other supplements which can reduce the oxidative stress like glutathione can help in slowing down the process of early graying. There is some data on in-clinic procedures improving this premature graying like mesotherapy, exosome treatments, PRP therapy, but this is not well researched and still in process. Some of the lifestyle factors you should improve are reducing the stress, improving your sleep quality, having well-balanced diet, and also having diet rich in antioxidants, a lot of fruits and vegetables. The most important factor you also need to consider is hair colors. Choose hair colors which are ammonia and PPD-free, as this causes a long-term damage to your hair. There is still a lot of research going on about stem cell activation, this in turn leading to melanocyte activation, but this process takes time and we might see some newer therapies for premature graying sooner. Some of the most common myths I tend to listen from my patients is that pulling out a gray hair will spread or increase the number of gray hairs. This is not at all true. This is just because of loss of pigment called melanin in your hair follicles, and it has nothing to do with pulling out your hair. And number 2, oiling your hair can control your gray hair. Again, a big myth, oiling does not have any role in your pigment production, so oiling won't cause any reversal of your premature graying. So finally, please understand that premature graying is multifactorial. Your genes, oxidative stress, nutritional deficiencies, all of these play a big role. Correcting your nutritional deficiencies and oxidative stress will slow down the process but might not completely reverse the premature graying. So treat the root cause early and delay the progression of early graying. If you like this video, please hit the like button below and subscribe to my channel for more tips on skin and hair.